Okay, so I'm going to talk about the immunosuppressive agents for systemic lupus erythematosus. We have one class which is called cytotoxic agents. We have azathioprine or Imuran, cyclophosphamide or Cytoxan, cyclosporine or Sandimune, and basically certain cytotoxic or anti-neoplastic drugs are effective as immunosuppressive agents. They act by decreasing the proliferation of cells within the immune system and are widely used to prevent rejection following a tissue or organ transplant. They are usually administered concurrently with a corticosteroid therapy, and what the benefit of this is basically it allows you to administer lower doses of both the cytotoxic agent and the corticosteroid because you don't want too much prolonged usage of corticosteroids, which result in fewer side effects. So, what are your responsibilities as a nurse? As a nurse, you got to monitor the blood count. Why do you have to monitor the blood count? Well, pay particular attention to the white blood cell count and the platelet count. Notify the physician if white blood cells fall below 4,000 or platelets fall below 75,000. Uh, you want to pay attention to the white blood cell count and platelet count because this is one of the effects of systemic lupus erythematosus, SLE. It basically decreases white blood cells, red blood cells, and thrombocytes. Um, After that, you want to monitor renal and liver function because it breaks down the liver and it causes neuropathy, cytosis, I believe, and pay in. So watch the liver function studies like creatinine, BUN. The creatinine should be increased. The BUN should also be increased, indicating kidney damage, and a let me see, glomerular filtration rate should be decreased because it's not working efficiently. So therefore, it should take long. Wait. I gotta look into that. But just monitor the GFR and the liver enzyme levels, and report any abnormal levels to the physician. The oral preparation should be administered with food to minimize the GI effects, because these will upset your gastrointestinal system. Antacids may be ordered, so either give the cytotoxic agents with antacids or with food. Um, Increase the fluids to maintain good hydration and urinary output. So basically, cytotoxic agents are like really bad for you. It can cause nephrotoxicity and nephrosis. And to avoid that, what you want to do is make sure to tell the person to take like 2,500 to 3,000 milliliters of water intake every day, and not to take the cytotoxic agents at night because you want to keep the drugs being eliminated at the appropriate intervals. So therefore, you want to drink a lot of fluids so you can pee it out. If you take it at night and you're sleeping, guess what? Those cytotoxic drugs that are very toxic for you are going to be sitting in your kidney, breaking down your kidney even more, and it's already known to cause nephrotoxicity. So keep them hydrated, increase the fluids to maintain good hydration, monitor the intake and output because if they're taking in a lot but they're not outputting a lot, I mean, you're going to be a positive, 1,400 milliliters every day. That's not good. It's going to lead to edema, all this other stuff. So basically, also monitor for signs of abnormal bleeding. Because, like I said, it can be hepatotoxic, cytotoxic agents. It has the word toxic in it. Cytotoxic, this agents can be hepatotoxic. So what it's going to do is cause abnormal bleeding. They could be bleeding in the gums, easily bruised. They hit the side rail of the bed and they start bruising. If you see petechiae, well, I don't know how you pronounce that, petechiae, whatever, which is basically like small bleeding and in the skin. If they feel joint pain, if you see blood in the urine, hematuria, or black and tarry stools, that's basically blood that got into your intestine and made it out to your poop. That shows that the liver is being broken down in a bad way because it is not producing the appropriate vitamin K, or clotting factor to stop these bleeding. Use meticulous hand hygiene and other appropriate measures to protect the patient from infection. Assess for signs of infection, because this is a immunosuppressive agent, meaning that it decreases their ability to fight the normal bacteria, and infectious agents. So the very simple, easy, and effective way to protect them is to practice meticulous hand hygiene. Now, pulmonary fibrosis is an adverse effect of these cytotoxic agents. So, when you're taking cytotoxic agents, Imuran, Cytoxan, Sandamune, these things can cause pulmonary fibrosis, but actually, it's really focused on cyclophosphamide, and cyclophosphamide is cytotoxin. So, cytotoxin, cyclophosphamide can cause pulmonary fibrosis, not really the other ones. So, monitor the results of pulmonary function studies and be alert to the clinical signs of dyspnea or cough. So, dyspnea and cough, when you see cytotoxic agents, you see cyclophosphamide, you see cytotoxin, you gotta watch out for the heart, for the lungs, because it can become fibrous, which would decrease the breathing. And in the ABC priorities, airways number one. So, health education for the patient and family. What do we got to teach them? We got to teach them, since they're immunosuppressed and they're taking cytotoxic agents, they need to avoid large crowds in situations where you might be exposed to infections. Report signs of infection, such as chills, fever, sore throat, any fatigue or malaise. So, infection in these people, again, is going to be shown as chills, as a fever, sore throat, fatigue, malaise, and report that to their physician. Use contraceptive measures to prevent pregnancy while you're taking these drugs, because these drugs, the cytotoxic agents, can cause birth defects, and you don't want that, right? Don't use aspirin or ibuprofen, because they both have aspirin in it, while you're taking these drugs. And report any signs of bleeding to your physician. And if you remember, we said that one of the responsibilities you have as a nurse is to monitor for signs of abnormal bleeding, which means they have increased risk for bleeding. And if you give freaking aspirin or ibuprofen to these clients, you're going to basically increase their chances of hemorrhage, you know what I mean, anywhere. So just be careful. Do not give aspirin for sure. Women, you let them know if you're taking cytotoxic agents. Women, you may stop menstruating, you may stop your PMS while you're taking cyclophosphamide, again, cytotoxin. And then the menses will resume after you stop taking the drug. And if you're taking cyclophosphamide, be sure to report difficulty breathing or cough to your physician because of pulmonary fibrosis. Thank you very much. This is Martin Reyes, the Nurse Ninja, signing off from youtube.com/the Nurse Ninja. Peace.